Hello everyone, for today I'm going to talk about epilepsy. But before that, let's clear some misconception about it. Particularly, seizure is not equitable or equal to epilepsy. Seizure ay yung pangingisay ng katawan. Seizures are symptoms of epilepsy. Seizures occur due to uncontrolled sudden increase of electric impulses inside the neurons of the brain. So seizures can be categorized into focal or generalized seizure. For the focal seizure, it happens on one side of the brain, wherein the patient could be aware or unaware, whereas the generalized seizure affects both sides of the brain at the same time. Status epilepticus is a seizure that has a long duration, which usually lasts for greater than 5 minutes. It may start as a focal seizure and may progress to generalized seizure. So for the first line of treatment for epilepsy, we have benzodiazepines. These include lorazepam, diazepam, phenytoin, phenobarbital, and valproate. There is also called refractory status epilepticus. This happens when the seizure is not controlled despite treatment with two anti-epileptic drugs. We also have longer-acting anti-epileptic drugs. These include levetiracetam, fosphenytoin, and valproate. So now let's move on to the misconceptions about epilepsy. During a seizure, a person could swallow his tongue. So do you believe this? This is impossible. A person cannot swallow his tongue. Hindi natin pwede malunok yung dila natin kahit ano pang mangyari sa atin. Another misconception is that seizure hurts. In fact, a person is unconscious and not in pain during most seizures. But rather, patient could only feel discomfort after seizure if they fall or something. Another misconception is that all epileptic patients experience seizures. So if that's the case, it can also manifest in other forms such as blank stares or nakatulala lang sa kawalan. So for the do's and don'ts kapag may epilepsy, don't put anything on the patient's mouth. Also, don't hold down the patient. Pabayaan lang natin sila. It will automatically stop. Also, don't give mouth-to-mouth resuscitation habang nag-e-epilepsy ang person. We also don't offer food or water until the patient is fully alert. Now, we go to the hospital if the patient has never had a seizure before. Ibig sabihin, first time niya magka-seizure. We also go to the hospital if may status epilepticus na nangyayari o yung greater than 5 minutes na yung seizure niya. Next, we also go to the hospital if the patient has other complications or the patient is pregnant. This is because baka na-harm na yung baby while the patient is experiencing seizure. Now, before I end this short talk, let me clear the biggest misconception about epilepsy, specifically about anti-epileptic drugs. So, sinasabi nila na much better ang branded drugs over generic drugs in terms of treating epilepsy. So, is there really a superior drug between the branded versus generic drug? The short answer is no. The problem rather relies on the switching of drugs. Kung mag-switch ka from branded to generic or generic to branded, it doesn't matter. What matters here, what the problem is here, is yung pagsuswitch ng drug. So, kung generic to generic ka pa, or kahit branded to branded ka pa, there's also a problem in it. One should stick on one drug, so it doesn't matter kung generic o branded yung gamot mo. What's important is that you don't switch drugs. So again, don't switch from generic to branded and branded to generic. This is to prevent seizure relapse. Thank you for listening.